Hello, everyone. My name is Paula Neves, and I'm the lead for the Center for Living Organ Donation. I'd like to welcome you to today's webinar on drug coverage and reimbursement. Our special guests today are Lucia Anghelache, a medication reimbursement specialist at UHN, and Dipika Munyal, a clinical pharmacist at UHN. And I will turn it over to Dipika to take you through the first part of the presentation. Dipika?
Hi, everyone. Today, Lucia and I are going to spend some time with you talking to you about what immunosuppressants are and what their goal is, to talk to you about a typical post-transplant medication regimen, to talk about what you might be on after organ donation, liver or kidney donation. Lucia will spend some time talking to you about the Canadian drug coverage landscape. In particular, she'll talk to you about medication coverage in Ontario. She'll discuss the differences between online adjudication versus pay and submit. She'll talk to you about medication coverage for some of you residents who are not from Ontario, and then talk about some interprovincial billing agreements we have with other provinces here at the Ajmera Transplant Centre. She'll give you a brief overview of the drug reimbursement algorithm in Canada, and then introduce you to our transplant outpatient pharmacy, and lastly end off with talking about her important role working with you to get your medications covered. So I'll start by very basic, just reviewing with you what immunosuppressants are. So immuno means our body's immune system. So it's our body's natural defense mechanism against what is harmful or foreign to us. And suppressant means an agent that, reduces or diminishes the intensity of. So immunosuppressants to some of you are also known as anti-rejection agents or anti-rejection medications. Next slide. Our goal of immunosuppressants is to prevent rejection of the transplanted organ and to minimize side effects and to minimize the risk of infection. So we want to use the lowest doses or the lowest amount of immunosuppression to make sure that you don't experience side effects or to minimize the risk of side effects, while at the same time preventing you from experiencing rejection. A typical post-transplant regimen that I reviewed with would be maybe one medication from each of the classes mentioned above, mostly from 3 of the classes. So typically, all of you will be prescribed a corticosteroid, prednisone most commonly, a calcineurin inhibitor, so either cyclosporin or tacrolimus, perhaps an antimetabolite, so those listed here, azathioprine or mycophenolate mofetil, which is called Celcept, or mycophenolate sodium, which is Myfortic. I know these are mouthfuls to pronounce for some of you. And lastly, very rarely, in certain circumstances, we may have to add on or replace with an agent in this class called an mTOR inhibitor. An example is sirolimus or rapamune. Next slide. You will be on some medications to prevent against infection. And again, you'll be on perhaps one medication from each class. A medication to prevent pneumonia, that would be a medication commonly known as Septra, once a day or 3 times a week, or Dapsone or atovaquone once a day. To prevent a kind of a fungus infection in the mouth called oral thrush, it would be a nice statin swish and swallow that you'll probably be on for about 3 months after transplant. And to prevent against a virus infection, we might put you on a medication called valganciclovir or Valsite, and that's a once-a-day medication. If you're considering organ donation, if you're a liver donor, we'll have you on an anti-clot medication for 5 weeks after liver donation, and it's a subcutaneous injection. It's not very painful, and we'll teach you how to use it. Prescribe you medications to prevent against acidity, pain, and to prevent against constipation after donation, and give you some supplements to replenish surgical blood loss. For kidney donors, you'll be prescribed a medication regimen of pain medication and something to prevent against constipation, because sometimes pain medications can be constipating. I want to just give you an idea of what costs look like after transplant or after donation. For a typical transplant recipient, costs can range anywhere between $1,500 to $2,500 a month. And for a donor, a living organ donor, the range lies between about $30 for a kidney donor and up to $450 for a living liver donor. I'm going to hand over to Lucia now, who's going to start talking to you about how you're going to cover these costs. It's not scary. We don't want anyone to feel that these costs should be prohibitive to get a transplant or to donate an organ. So Lucia will go through different mechanisms with you now.
Thank you, Dipika. Hi, everybody. Just like Dipika said, this should not be a scary endeavor. There are plenty of resources out there to help you navigate drug coverage in Canada. So I will do my best to take you through the process of how you can access drug coverage in Canada right now. Unfortunately, Canada does not have a national healthcare plan. What this means is that each Canadian province and territory is different to what they offer in terms of drug coverage to their residents. Under the Canada Health Act, medications administered in Canadian hospitals are provided at no cost to the patient. So it's important to retain in hospital, okay? Outside of the hospital setting, a patient must rely on their provincial and territorial government for a publicly funded drug program or on their private plan or a combination of both. The publicly funded drug programs generally provide coverage for those most in need based on age, income, and medical condition. Canada is the only country in the world that has a universal healthcare system, but does not have universal coverage for prescription drugs outside of the hospital. Medical care is indeed free in Canada and includes everything other than prescription medication, vision care, and dental care. Our main focus today will be medications used outside of the hospital, or the medications prescribed on discharge that Dipika mentioned to you, the post-transplant immunosuppressive medications, the anti-infection medication, and the post-organ donation medication. So let's start by talking about private drug coverage. So you can obtain private drug coverage through your employer, through your spouse, through your parents, and through your school if you're a student. You may have to pay a membership or a premium to be part of this plan, and your particular drug plan may cover a percentage of your medication or 100%. You may have a copay or fees for prescription that you may have to pay, or you may have annual maximums or lifetime maximums as well. And certain medications may require special approval. And that is why it's very important that you reach out to your private plan to determine which medications are required after your transplant will require special approval, so that your prescribing physician will be ready and will know that those approvals must be in place in order for you to have access to your medication. And so it's very important that you do that. We do have a list of commonly prescribed medications and their drug identification numbers that we can provide to you. And we encourage you to submit that list. It's very important. So if you have access to a private drug plan, or even if you do or if you don't, there are some important programs offered by the Ontario government that you may qualify for if you have a valid OHIP card. This is through the Ontario Drug Benefit Program. The Ontario Drug Benefit Program formulary is very generous, covers almost 5,000 medications. And if you qualify for the Ontario Drug Benefit Program, if you're enrolled in a Trillium drug program, if you receive social assistance, if you're a senior, so 65 and older, if you're under 24 and don't have access to a private insurance plan, if you reside in a long-term care home, or if you receive home care services. So today we'll focus our attention on the three most common ways in which our transplant patients are eligible for drug coverage under the Ontario Drug Benefit, and notably the Trillium drug program. The Trillium drug program, I would say is the most important one. Why? Because it's available to all Ontario residents with a valid OHIP card under the age of 65. It is based on family income and total drug costs. An individual or family will pay a certain amount of their drug costs. This is called the deductible. And after that, will be eligible for drug coverage for costs over and above the deductible amount. There's a sliding scale, such as larger income earners pay more, but eventually they too will be eligible for coverage if their drug costs are high. Applications are available through most retail pharmacies. They can be given to you by your transplant coordinator or social worker or myself, or you could go online. You could just Google Trillium Drug Program application. It will take you to the ODB forms repository where you can actually download the form. It is a PDF format, very easy to fill out. You fill it out online on your computer, and then you print it off, you sign it, and you submit it. And it is, like I say, a very easy and user-friendly process. The only thing to consider is that everybody living under the same roof will have to be enrolled in a Trillium program, and everybody over the age of 16 will have to provide proof of income. And the way Trillium does this is they verify income with Canada Revenue Agency. So it is important that you do your income tax on time every single year. Very important tidbit there, okay? The Ajmera Transplant Centre requires that all Ontario pre- and post-transplant patients maintain an active registration with Trillium. It's very important because the drugs required after transplant are very expensive, like Dipika mentioned. Trillium registration is necessary. You have 100% coverage. So even if you think you don't need it, trust me, you will need it. It's very important. So what happens is that, let's just say that a particular medication requires special approval, and we apply for that special approval and it's rejected by your private plan, because it does happen. If you don't have Trillium in place, you will be liable to pay out of pocket for your medication. However, if you do have Trillium, you have another option there to secure coverage through the Trillium program, because as I said, it is a very generous program, covers almost 5,000 medications. So it's important to maintain an active enrollment with Trillium. And also important to retain is that there's no cost to register with Trillium, and the application takes only a few minutes to complete, very easy. And the registration with Trillium does not jeopardize or interfere with your private drug coverage. Patients with private coverage should continue to use it and apply to Trillium for those drugs that are covered, that are not covered, or are only covered partially. Okay, so it's important. And then another important piece of information is that you have to plan in advance and have Trillium in place, because it does take a few weeks for the application to be processed. So make sure you're proactive and apply to Trillium on time. The other important program under the Ontario Job Benefit is the Social Assistance Program, which offers Ontario Disability Program and Ontario Works, so ODSP and OW for short. Both offer income support for basic needs, drug coverage, and employment support, but the main difference between them being if an individual has a disability or not. There are two categories of ODSP recipients: permanent with permanent disabilities and temporary. Your physician indicates on the application form whether the disability is permanent or if there's a possibility of recovery. There's a small co-payment for each prescription. However, most retail pharmacies choose to waive this fee. And one thing to retain here is that most patients on dialysis have temporary ODSP status. What this means to them is that once we transplant them and they get better after the surgery, after the transplant, their ODSP, they will no longer qualify for ODSP. Therefore, it becomes paramount that they have Trillium in place to bridge that gap, so that they don't run the risk of having to pay upfront or out of pocket for their medications. The seniors drug plan is for those aged 65 and older. The government of Ontario will send individuals 3 months prior to their 65th birthday a letter informing them that they will be automatically enrolled in the Ontario Drug Benefit Program on the first day of the month following their birthday. There's a small co-payment on each prescription, and this usually ranges between $2 and $6, depending on the individual's income level. Some retail pharmacies may choose to reduce or waive this fee, and some high-income seniors may have to pay an annual deductible of $100. So here's an exception to what I told you before, that Canada did not have a drug coverage, vision, or dental care plan. The federal government does provide extended health coverage for Canada's First Nations and Inuit people through the non-insured health benefits, NIHB for short. So what this means to recipients of NIHB is that they have access to 100%, so full coverage for prescription medications, as well as vision and dental care. There's no deductibles. There are no fees associated with this plan. So it is self-sufficient. And so recipients of NIHB do not need to apply to Trillium. And that's pretty much the only exception that I can think of. All the other groups should consider applying. So now let's talk a little bit about how medications are being billed. And there are multiple ways through which we can bill for medications. The first and most commonly used one is online adjudication or direct billing. In Ontario, you can direct bill Ontario Drug Benefits, which means that everybody that I mentioned before under the Trillium drug program, social assistance, and seniors, the pharmacy can bill those programs directly. For patients with a private plan and a paid direct drug card, pharmacies can process claims on the spot. Patient presents the card to the pharmacist, who submits the claim electronically to the insurance provider, and it is adjudicated in real time. This just a few examples of paid direct cards. The green one is our OHIP card. Hope is recognizable. The other two are just two major private insurance companies that we typically deal with. So if you have like this that are given to you by your employer or your private insurance plan, you can rest assured you don't have to pay upfront for your medication. You could pay a little co-payment when you fill your prescription, or you could pay nothing depending on how your plan is set up. Another way to bill for medications is through pay and submit. So patients must pay in full for prescription drugs if their plan does not provide a paid direct card. They have to fill out a claim form and attach the original pharmacy receipts, and then mail those documents to their insurance provider. And then if they're eligible for that particular medication, then they will receive a check. They can also submit the claim through the insurance plan website if it's offered. And that's usually a faster way to adjudicate because they can be reimbursed by check or direct deposit. So now let's spend a little time talking about out-of-province patients and how they can access drug coverage outside of their home province. So if you're from another province or territory, special arrangements will need to be made in order for you to obtain hospital care and prescription medications in Ontario. Making these arrangements often requires special paperwork from your home province and can be a time-consuming process. I just want to stress that it's very important that you have these approvals in place prior to arriving in Ontario if you wait for your transplant, because if you're here physically and those approvals are not in place, it may delay your listing, it may delay your surgery. So it's important that you do that beforehand, because your prescribing physician or your specialist, they have to make sure that your province is aware that you will be outside of your province for an extended period of time, and you have to have those approvals in place prior to arriving. So it's very important that you have that before arriving in Ontario. So filling prescriptions outside of your home province, for instance, when you're in Ontario after you've received your transplant, could be very tricky. Over the years, we at the Ajmera Transplant Centre have been working closely with various provinces to develop billing processes with Newfoundland, Prince Edward Island, Nova Scotia, New Brunswick, Quebec, and British Columbia. This means that if you're from any of these provinces, you have access to the same drug coverage as you do in your home province when you're here in Ontario. This is an incredible thing for out-of-province patients, as the stress of paying a substantial amount of money is alleviated. The Canadian reimbursement algorithm, we call it algorithm, is more of a chart for us to understand how coverage is done depending on the province and territory, and how we can bill for those different private plans and provincial plans. So in Canada, drugs are covered differently depending on the province of residence. In most provinces, private plans are first payers, meaning the pharmacy bills the private plan first, and provincial plans are secondary payers. So those would be billed after the private plan. And billing sequence. So pharmacies must be aware of this billing sequence, and I can assure you that our transplant pharmacy here at the Toronto General Hospital is very much aware of that. We've been doing this for years, we know. Some provinces may allow their residents with private insurance to also enroll in a provincial drug plan, while others do not. And this is dependent, it could be dependent on age and or financial status. So it's very different depending on the province of residence. This is the chart or algorithm. Ontario is highlighted there. I hope that everybody knows how coverage works in Ontario. Under the age of 65, the rule of thumb is private first, public second, and is reversed for our seniors. I would like to draw your attention to Manitoba, because we get a lot of patients requiring a liver transplant for Manitoba. And if you look closely, you will see that for under 65 or over 65 in Manitoba, the provincial plan or public plan is preferred payer. What this means for those patients is that at the pharmacy, when they fill prescriptions, the pharmacist must bill the provincial plan, which is called PharmaCare in Manitoba. And if they have a private plan, that would be a secondary payer, it would be billed second after PharmaCare. The problem is that we don't have a billing agreement with Manitoba. So what this means to our Manitoba patients is that they have to be prepared to pay upfront and submit the receipts once they're back in Manitoba. So it's important to have those buffer funds and ensure that you can afford this. Next. So let's talk a little bit about what you would be expected to pay when you fill a prescription at the pharmacy. So different things. You could pay a co-insurance, meaning the percentage that your private plan doesn't cover. It depends on how your plan is set up. Some plans pay 70%, 80%, 90%. The co-insurance means that you would pay the difference that is not covered by your private plan. So if your plan is 80%, you pay 20%. Co-payment means that you pay a set amount per prescription, and some plans may have both a co-insurance and a co-payment, okay? And you may also pay deductibles. That could be an individual or family deductible. They're usually billed at the beginning of the benefit year. Dispensing fees. Some plans do cover dispensing fees partially, and some don't cover at all. So you'd be responsible to pay for dispensing fees in full if your plan do not cover them. Also, the Trillium deductible, which is income dependent, as we discussed earlier, you would pay that at the pharmacy when you pick up medications if your deductible is due for that particular quarter. The seniors ODB deductible, high income seniors pay $100 per year, and they also pay $611 or $283 per prescription. The cost of over-the-counter prescriptions, so those are your supplements, vitamins, minerals, which are not covered by any private plan or provincial plan. And the cost of drugs that may not be benefits on your particular plan, which also can come about. And speaking of what you will be paying at the pharmacy, let's talk about our transplant outpatient pharmacy, which is the first and only transplant specialty pharmacy in Canada. They're located on 12th floor at the Peter Monk building at the Toronto General Hospital in the clinic area of the Ajmera Transplant Centre. We have at the pharmacy billing agreements with Quebec, Nova Scotia, Newfoundland, New Brunswick, Prince Edward Island, and British Columbia. And what this means, as I explained earlier, for residents of those provinces is that they will no longer be required to pay upfront for their medications, including immunosuppressants. And this pharmacy has access to many patient assistance programs, very important as well, because they can help reduce your out-of-pocket cost. And they typically waive the $2 copay for income seniors. Remember how I mentioned earlier how some pharmacies do waive or reduce the fee? We're one of the pharmacies that does that, and charges $283, so reduced fee for high income seniors. And our pharmacy has access to some special cards that were given to us by the drug manufacturers. And those cards are either set up to cover the difference between brand and generic, or they can provide a copay assistance or compassionate use, notably for blood thinners. So the liver donors usually require blood thinners, and we'd have cards for those two medications that can help to offload some of that cost. We also have access to some patient assistance programs. The first is the Expedite Patient Support Program, and it's the one that we use most. It's for tacrolimus, so for Prograf and Advograph, and it is a card system. I go through the eligibility criteria with the patient. I identify whether the patient qualifies for this program. You do it over the phone, usually with the patient. And then if the patient qualifies, I can actually go online and activate that specific card for that specific patient. And then I input the information in the transplant outpatient pharmacy database. And then they can use it at the point of discharge to offload some of that cost, be it a copay that the patient has to pay or a Trillium. The RapidSure program is for patients on sirolimus. And I should say these are all immunosuppressant medications, okay? So RapidSure, unfortunately, is not a card system, it's still paper-based. We have to fill out a form to submit it to the program, and they have their own reimbursement specialists that take over from there. But it's still a program that we can access on behalf of our patients, and we do. We have prescription saving cards that are funded by participating pharmaceutical manufacturers to help cover the cost of certain brand name medications. So that helps to take care of some of that cost that patients may incur. And, the patient assistance program and Lovenox patient benefit program for liver donors with inadequate drug coverage. So we can apply those cards for those particular patients to alleviate some of that cost as well. So this is a slide. I don't like to talk about myself, but I will, because it's for your benefit. I just want to say that I typically work in a background, so don't be alarmed if you receive a call from me after your transplant, okay? I'm just looking out for you. Usually I collect insurance information and then I go through your insurance drug coverage step by step if you need assistance from me. I also may assess you for eligibility for those patient assistance programs to make sure you maximize your drug coverage. And overall, I ensure that you have access to adequate drug coverage so that when it is time for you to go home after your transplant, that the process will be seamless and you will have access to drug coverage for the medications that you were prescribed after your transplant. I work closely with the inpatient and outpatient teams, and I make sure that if a particular medication does require special approval, that I coordinate with the inpatient pharmacy group so that we fill out the paperwork and we obtain approval for you prior to your departure from hospital. And moving on to conclusions. I just want to say that access to medication should not be a barrier to organ transplantation or organ donation. And as I said earlier, a list of commonly prescribed medications should be submitted to your private plan prior to your transplant to mitigate surprises post-transplant to ensure for timely applications to be made if required. This is very important, okay? Enrolling in Trillium is also important. So if you do these two steps, in addition to whatever drug coverage you have right now, whether a private plan or ODSP or Ontario Works, etc., if you provide that list to your private plan and you obtain a response from them, you confirm which medications are covered, which require special approval. If you have an annual maximum or lifetime maximum and you complete an application with Trillium and you maintain an active enrollment with Trillium, there should be no barrier to you coming forward to receive a transplant or to become a donor. And I also want to say that those patients that receive benefits from the social assistance or DSP or Ontario Works should ensure that their files are up to date with their respective caseworkers or case manager, because if there are issues, our social workers should have access to your case manager and be able to discuss with them specifics regarding your file and resolve any issues that may arise so that we don't delay your discharge. And also there are many resources to help you navigate drug coverage, such as myself, such as the social workers or our transplant outpatient pharmacy.
Thank you. Thank you very much, Lucia, and thank you, Dipika. This presentation was really important because we've been receiving quite a number of questions from transplant candidates, from transplant recipients, from family members, and from living donor candidates. And so today's presentation provided an overview of the system and the supports that are currently available. We know that there will probably be questions that are very specific to each situation. So please be in touch with the transplant outpatient pharmacy. And they will aim to answer all of your questions and ensure that you have the support that you need. We will also collect answers to some of the most commonly asked questions following this presentation that we will add to the description box on our YouTube channel. So please visit our YouTube channel for more information. Thank you to Lucia and to Dipika for terrific presentations, and thank you to all of you for joining us today. Join us next month for another topical presentation on living organ donation and transplantation. Thank you for joining us.
Thank you.